Assalamualaikum and a very good morning to Dr. Farahia and to all my fellow classmates. So today we are going to present about innovation of suiting up. Tuck your suit like an old man. All right, moving on to the next one. So let's meet our team members. We have Aina Zinira, we have Uwan Sarahanan, we have Nakiba, we have Tanting Sen, Azliana, and me, myself, Sharifah Haura. Okay, moving on to the next one. So let's look at the introduction. So the task that we did was suiting up and experience learning. So here we have 10 items. Let's look at the Google. So Google is used to indicate due to cataract. So we have elbow restrictor that are used to limit the elbow movement. We have glove that is used to indicate sensory problem. And we also have knee restrictor where we use Velcro strap that is used to roll over the knee to indicate limited knee ROM. So we have weight cuff, used to indicate limited ankle mobility, or we call it a sarcopenia. We have pillow neck, where it is used to indicate neck stiffness. We have tissue paper that the tissue will roll at the finger to indicate the arthritis. We have wrist weight, where we use weight cuff that are loaded on the wrist to stimulate loss of muscle strength, also called as sarcopenia. We have used walking frame stimulate how a poor balanced elderly ambulate. We also have transfer belt that is used to stimulate bending posture. All right, for the next one, I'll pass to Hanan.
Thank you, Hara. So I will continue with the material that you use. So there is 8 materials. The first one is transfer bag, weight cuff, pillow neck, glove, next. Walking frame, goggle, Velcro strap, and tissue paper. Next, the cost for the items is transfer bag. The estimate cost is 36 ringgit and 49 cents, while the actual cost is 0. Weight cuff, the estimate cost is 14 ringgit and 19 cents, and the actual cost is 0. Pillow neck, the estimate cost is 35 ringgit, but the actual cost is 0. Glove, the estimate cost is 10 ringgit, but the actual cost is 0. Next, walking frame, the estimate cost is 150, but the actual cost is 0. Goggle, the estimate cost is 5 ringgit, but the actual cost is 0. Last but not least, Velcro strap, the estimate cost is 20 ringgit, but the actual cost is 0. And lastly, tissue paper, the estimate cost is 2 ringgit, but the actual cost is 0. So the total for the estimate cost is 238 ringgit and 39 cents, meanwhile for the actual cost is 0. Next. This is because all the items and tools was borrowed from the occupational therapy clinic and another group. As a result, the actual cost is only 0, whereas the estimate cost is 238 ringgit and 90 cents. So next is the activity chosen. We choose next. We choose transfer to bag.
Next is limitation or difficulties. The first difficulty is mobility insufficient caused by low vision. The article below is the evidence to support our limitation finding. The title of the article is Age-related Eye Disease and Mobility Limitation in Older Adults. The objective is to extend of mobility limitation in patients with age-related macular degeneration, glaucoma, or fuge corneal dystrophy compared with that in a control group of older adults with good vision. The discussion states that all patients with vision loss had reduced mobility, but the pattern of mobility impairment differs by diagnosis. Thus, mobility insufficient is one of the limitations that faced during the daily activity performance. The next limitation is limited ROM caused by arthritis. The article that we found is a model of impairment and functional limitation in rheumatoid arthritis. And the objective is to test a model of impairment and functional limitation in rheumatoid arthritis using empirical data from a sample of RA patients. From the result, we can conclude that arthritis can cause functional limitation for elderly. Next. The next limitation is a limited range of motion due to loss of muscle strength. And the titles of the article that we choose is the loss of skeletal muscle strength, mass and quality in older adults, the health, aging and body composition study. From the result, we can conclude that as we grow older, the strength of the muscle will be declined.
Next, elderly also has limited RM caused by neck stiffness and back pain. The title that we choose, the article that we choose is Back and Neck Pain in Seniors. And to conclude, from the result and the discussion, it is stated that elderly who has neck pain and back pain indicate that they have altered or diminished their physical activities due to the disease. And both neck pain and back pain of longer duration were associated with significantly lower physical performance scores. And from Leventhais, after interviewing all the elderly who has neck pain and back pain, it is stated that they have difficulty performing their daily activities and need to have a care seeking for their daily basis. Next. Elderly also have limited RM caused by knee pain. The article that we choose is Impact of Knee Pain, of Fear of Falling, and Changes in Instrumental Activities of Daily Living and Falls Among Malaysians aged 55 years and above. And this the objective of this article is to see the relationship between the knee pain and also fear of the risk of falling. And from the results, we can state that people who has knee pain are associated with increasing of age, female gender, reduce of muscle strength, and increased BMI, with associated with increased risk of falling. And from the table, the second table indicates that the significant association between knee pain at baseline and declining of IADL performance was found initially. This was caused by advanced age, increased BMI, comorbidities, and demographic differences. And however, the article also stated that the studies of knee pain did not lead to any change in IADL among baseline of non-fallers, which means that the risk of falling, the knee pain only happened to elderly who has history of fall. Next. Elderly also have decrease in touch sense caused by sensory deficit. The article that we found is sensory specific older people, and this article the objective of this article is to see the decreasing impairment of people. And to conclude from the result, as you can see in the table, it indicates that elderly was foundly has highly impacted in auditory sensory compared to other sensory. And for touch intrinsic structural changes and And for touch, it is stated that the reason of sensory decline as outlined in the theory are because of the intrinsic structural changes of the skin that take place during aging, leading to the sensory deficiency. Next. Okay, lastly, elderly also has unbalanced gait that caused by bending posture. The article that we find is significance of posture in relationship to falls in elderly. The objective of these articles is to study the relationship between person's posture and their risk of falling, and to conclude from the results, most participants who were measured with severe kyphosis, which is bending posture, would represent fall risk in their daily life activities. Okay, next.
Okay, thank you, Aina. Now I will continue with reflection. So this is our reflection. So how do we feel while wearing the suit? We get to experience slight physical loss, but of course it was not comparable to the actual condition. And some of the movement were restricted, making it hard for us to emulate freely. It was very uncomfortable, especially in the neck, elbow, knee, and back area, as the suit was allowing us to live as an elderly for a moment. We faced some difficulties, especially while performing some simple action like trying to get up from the bed, walking, open doors, and sitting on a chair. In spite of the fact that we were not actually in pain, we did feel weak and helpless because we could not do even the simplest task with ease. After we wear the suit, our perception towards the elderly changed fairly, as we thought initially that it was not that hard to be an elderly due to the fact that they gradually get old, so they has learned to adapt all the physical changes. It truly was an eye-opening experience, since only after wearing the suit we are able to understand the hardship of being an elderly due to physical limitations. To summarize, we should be patient and compassionate towards the elderly because they are trying their best to live despite of their shortcomings. So this is our book references. That's all from our groups. So thank you very much.